Hi, I'm Dr. Sacha McBain. I am a clinical psychologist and associate professor at Rush University Medical Center in Chicago, Illinois, in the United States. My work focuses on understanding and addressing medical trauma. And today I'm happy to share an update to the International Society for Traumatic Stress Studies resources on medical trauma as part of the Friday Fast Facts initiative. Back in 2020, ISTSS released fact sheets for patients and mental health clinicians, along with a research brief to help raise awareness that medical events and healthcare experiences can sometimes cause psychological trauma. Since then, research in this area has grown quickly. We now know more about how common medical trauma is, the ways that it affects recovery, and how it impacts not just patients, but also healthcare professionals and caregivers. Medical trauma is best defined as the psychological and physical reactions that come when someone experiences or witnesses a major medical event. This can include things like injury, brief or ongoing pain, serious illness, a life-changing diagnosis, medical procedures, or really any frightening treatment experience. And it can result from a single event like an emergency surgery or a series of difficult experiences. This might be something like intubation or a progressive illness like cancer. Afterward, people might also deal with other problems, money problems, body changes that can make coping more difficult. And it's not just patients that are impacted by medical trauma. Caregivers also can experience similar distress when supporting a loved one, and healthcare professionals can also be impacted, sometimes developing what we call secondary traumatic stress. The new Friday Fast Fact materials build on what we developed in 2020. We've now included a sheet specifically for caregivers and one for healthcare professionals. These were created with input from people who have lived experience of medical trauma, so they really reflect real-world needs and perspectives of those navigating the impacts of medical stress and trauma. Each sheet explains what medical trauma is, how to spot signs and symptoms, and offers practical strategies for coping, supporting others, and getting help. They're free, they're easy to share, and useful whether you are a provider, a patient, a family member, or an educator. These resources are meant to start conversations and spark change in how we address the psychological impact of medical care. You can download all of them from the ISTSS website as part of the Friday Fast Facts series. I encourage you to read them, share them, and use them to support healing for those impacted by medical trauma.